Good evening, my name is Juan Escobar, and this evening I'm going to talk about this medication, albuterol. I choose this medication because I'm asthmatic. All the time I carry this medication with me. And also I choose to talk about this medication because I live in New York City, and here we tend to suffer from a lot of weather changes. And of course, we tend to suffer from asthma too. This medication is a bronchodilator medication. This medication selectively stimulates beta-adrenergic receptors of the lungs and vascular smooth muscles. Bronchodilation results from relaxation of bronchial smooth muscle, which relieves bronchospasm and reduces airway resistance. This medication is usually absorbed through the respiratory tract, however, dose is mostly swallowed and absorbed through the GI tract too. This medication does not cross the blood-brain barrier. This medication is extensively metabolized in the liver, and this medication is rapidly excreted through the urine and feces. We can say that 70% of the medication is excreted through urine and 10 to 30% through feces. We have to be careful when we talk about this medication. We have to educate our patient about the adverse reaction that this medication has. We can talk that mostly or some adverse reactions are very common. For example, tremors, dizziness, insomnia, headache, weakness, tachycardia, palpitation, hypertension. We can also talk about nausea, vomiting. We can also talk about muscle cramps, cough, wheezing, and we can say, or we can educate our patient to identify these side effects, and if these side effects persist, to talk to their provider. We have to talk about a special consideration for specific type of patients. For example, in pregnant patients, we can talk about this medication can cause cleft, palate, and limb defects. However, there is no consistent pattern of congenital abnormalities. Also, we can say that in geriatric patients, we have to give lower doses because geriatric patients are most sensitive to this type of medications. We have to instruct our patients how to use this medication before prescribe it, of course. We have to educate them that they need to shake the medication before they use. Usually this medication is given through metered dose nebulizer. It's like a tube, so they can absorb all the medication. But I don't have the tube with me. I usually use the medication without the metered dose nebulizer. So what I usually do is I shake the medication, then I exhale. Then I spray the medication into my mouth, I inhale and I retain, and I stop the breathing and I retain the medication in my lungs for about 10 seconds. I won't do it here because I don't want to waste time in the video doing that. And well, that's all the video. That's my education about this medication. So thank you so much. Thank you for your attention, and have a blessed day.